Yeah. Good afternoon. Today we are here for a discussion, sweet and a short discussion on hepatitis B. When I say hepatitis B, hepatitis means that there is inflammation of the liver. Inflammation of liver is possible by many ways, and hepatitis B is a virus which is one of the very responsible thing, and it's an infectious disease which gets transmitted by blood. Now, you cannot get hepatitis B infection in anybody's body without having blood contamination into that person. Now, the big question is, how does this blood get into somebody's body? The commonest cause for blood contamination in anybody's body is that if you go to a barber and if by mistake he uses a shaving razor which he has already used for some patient who was hepatitis B positive, and if he happen to use it on you, then you can get that infection. Another way you can get this infection is by a needle prick which has been contaminated by a hepatitis B positive patient. Third thing is, if you have a pregnant female who's hepatitis B positive, and if she conceives and if she delivers, during the process of delivery she transmits this infection to the fetus. This is a very important cause, since in our society we are getting more and more aware about vaccination of hepatitis B. So most of our population, educated population, are hepatitis B vaccinated already. But when we have a mother who is hepatitis B, she transmits this infection to the fetus, and fetus subsequently transmits this infection to the next generation. This is called vertical transmission. When you get this infection across the society, like you getting it from a barber, or if some less intelligent people gives you an injection which has been contaminated, needle which has been contaminated, it's called a horizontal transmission of infection. The most important thing is, for hepatitis B, is it's a preventable disease. It's preventable because we have a very good vaccine for this, and this vaccine takes care and it gives up to 98% immunity to a person who gets this infection. Now, when we talk about the prevalence of this infection in our society, so if you are in a marketplace, depending on the blood bank data, 5% of the population has hepatitis B infection present in them. So as to say that if we are sitting in a hall with 100 people, there is a probability that 5 people amongst these 100 people have this infection. Either they acquired it from society, they acquired from mother, or for any reason they have this infection in them. So the most important challenge in front of us right now is to take care of vertical transmission, the transmission from mother to fetus and the next generation. The most important thing for hepatitis B is, this virus is more dangerous than HIV virus also. We are reasonably well educated about HIV infection, but we do not know, or may I present it like this, that the society is less educated on the fact that hepatitis B is more contagious than HIV infection also. Moreover, what happens when this hepatitis B infection gets into somebody's body? There can be 3 situations in this. For example, if you get this infection, if somebody gets this infection in the process of parturition, that is, a mother gives this infection to a child, 95% probability that this infection is going to become chronic in that child's body and it's going to harm the liver. If somebody gets this infection after the age of 10 years, the probability that this infection becomes contagious and it starts harming the liver and it causes chronic hepatitis, the possibility is less than 5%. Therefore, to say that pregnant females have to be very careful about getting their hepatitis B tested, because even if you have a mother who is hepatitis B positive, and at the time of delivery, if you are able to give immunoglobulins to the child, the moment the child is born, we can prevent this transmission of infection from mother to the child. Another very important thing is that when you have a spouse which is positive for hepatitis B, the risk of transmission to the other spouse is also very high during intercourse. Therefore, if somebody knows that he or she is hepatitis B positive, it will be fair to tell the partner that the partner is hepatitis B positive, and if he or she gets a vaccine, then this transmission during intercourse can be prevented. Now, presuming that somebody gets a hepatitis B infection, what's going to happen? If an adult gets this infection, the 95% probability that this virus goes and sits silently in somebody's liver and it does not multiply. When it does not multiply, then it does not cause damage, though the risk of causing damage always stays. Therefore, the person who has this hepatitis B infection but lying silently in his liver should be very cautious. He should not donate blood. He should, if ever he needs a surgery and if he goes to a doctor, he should tell the doctor that he is hepatitis B positive, so that the medical staff can take due precautions while doing his medical treatment. Another important thing is, he should make sure that when he visits a barber, that the needle, razor, etc. are reasonably destroyed. Otherwise, accidentally or intentionally, if it is reused, then the risk of transmission is very high. Now, for those unlucky 5% of patients, adult patients, who would have hepatitis B virus multiplying in their body, or for those unfortunate infants born to hepatitis B positive females, if they have this infection and if this infection starts multiplying in their body, it starts damaging the liver. Now, when the liver starts getting damaged, then the problem is that patient develops liver cirrhosis. Liver cirrhosis is another serious life-threatening problem which has no cure but for a transplant. These patients will have, gradually their liver will go on shrinking, and the moment their liver shrinks, then it starts developing fluid in their abdomen. These patients can vomit blood and they can become unconscious, they can have altered sensorium, and they can have other problems related to liver cirrhosis. Moreover, these patients who are who develop liver cirrhosis have up to 30% risk of developing liver cancer also. This liver cancer is called hepatocellular carcinoma. Again, once if somebody gets this hepatocellular carcinoma, then if it is detected on time, it can still be treated, but if not, then it is again a life-threatening problem. Therefore, to summarize the situation, hepatitis B is a bad virus. It's a very infectious virus. It can transmit horizontally, that is, you can get this infection from society, you can get it in your family. The infection gets transmitted from the mother to the child, the newborn child. Therefore, we need to be careful about this. The good part about the hepatitis B is that it's a treatable problem. Treatable in the sense that if you are adequately vaccinated, then this infection can be controlled. Or to say that the person, if he gets a hepatitis B vaccine, then he gets immunized and protected against hepatitis B infection and for the rest of his life. The vaccination is very simple. You need to take a prick in your deltoid, in your arm muscle on first day, then it has to be repeated on 1 month later and 6 months later, and at the age of 5, after 5 years from the date of first injection. If somebody does this, then he gets good immunity, and this immunity protects this person for having this infection for the rest of his life. Now, what about those patients who are unfortunate, who had contracted hepatitis B infection, and this hepatitis B infection has taken a chronic status in somebody's body? Medical science has its own role here also. Up to 70% of these patients can be treated also. The end point of treatment is obviously getting rid of the hepatitis B virus. So, as to say that we have 3 modalities of treating these patients. For those patients in whom the chronic active hepatitis has damaged the liver and patient has developed liver cirrhosis, the final treatment would stay as liver transplant. But for those patients who are detected on time and the virus has so far not damaged the liver, we can put these patients on an injection called pegylated interferon injection, and when these injections are given on a weekly basis, these injections will adequately control the viral replication in the liver. That is to say, the multiplication factor of this virus gets hindered and this virus will not multiply further, therefore it will further not cause any more injury to the liver. Another modality of treatment for these patients are tablets. We get tablets, and over a period of time, now we got nice tablets. We started with lamivudine, then we came on to entecavir, and then we came to tenofovir, so on and so forth. But we have got reasonable good amount of medicines which, if given, can control the replication of this virus. Therefore, it can effectively control the disease causing status of the virus can be controlled. Now, the important thing from the perspective of the people who take care, healthcare personnels, these healthcare personnels should be very careful about making sure that their hepatitis B status is negative, one, and if negative, then they should get good vaccine, and also make sure that the vaccine they got gave them a good amount of immunity. So, by a simple blood test, any medical personnel will be able to know that the infection, the immunity has been acquired. If this has been done, then the healthcare personnel is reasonably protected against accidental contamination of his or her blood while treating a patient who is hepatitis B positive. Another very important thing here is that once if you know that a hepatitis B patient comes to any health personnel's clinic, it's not only important to treat that person only. Simultaneously, you should always ask about the hepatitis B status of the spouse, one, close siblings like brother and sisters, and also the hepatitis B status of mother and father. Because if you are able to know this, then we are going to adequately take care of the family, and if you know this, then you will be preventing the further vertical transmission of this virus in somebody's body. Hepatitis B is a disease of newer society also, as in our society we have drug abuse, people taking intravenous injections. These are the patients who have rapid contamination of this virus infection. Presuming that these population of patients have co-infections. Co-infections means that somebody has hepatitis B, simultaneously hepatitis C is also infected in them. Then somebody has HIV also in them. These are people who should require special precautions while treating these patients, because they are immunocompromised, and in them the virus spreads very fast and damages very fast. Now, the important thing is, if you have a person who has hepatitis B infection and his liver is damaged, he should be careful that the disease should not further progress into hepatocellular carcinoma. This can also be reasonably prevented by timely examination by doing a simple blood test called alpha-fetoprotein, doing a CT scan and ultrasound. And if you put these patients on medicines, the risk of having hepatocellular carcinoma also goes down. Another very important thing about hepatitis B virus is for the health personnels. Health personnels should not only be careful about taking care of their own health while treating the patients who are hepatitis B contaminated, but at the same time there should be a reasonable awareness amongst society about this problem. For presuming that if you are visiting a doctor, you should not hesitate to ask about how the equipments are disinfected, what kind of needles they are going to use, what kind of injections they are going to use. If you are going for surgery, make sure that you should ask a doctor that the system, the equipments the instruments, etc., whatever is being used, are adequately sterilized so that there is no risk of transmission. Moreover, it's been observed that dental surgeons are more prone for this infection for a simple reason that these are personnels which will have to use their muscle while pulling out impacted teeth. They get injured themselves and simultaneously get infected also. Now, what happens if somebody gets an accidental ingestion of hepatitis B infection? This is again treatable. It is treatable because the moment you know that you have this infection, there are immunoglobulins available in society, and if this immunoglobulin is taken within 24 hours, the contamination which has gone into somebody's body can be effectively controlled. Therefore, the risk of transmission for this patient, risk of getting this infection, can be controlled there and then only. Therefore, to say that, to summarize this whole story, hepatitis B is a contagious virus. One should be very aware. 5% of our population, Indian population I am talking about, 5% of the Indian population has prevalence. India has prevalence of 5% infection in society. The risk of horizontal transmission has been decreasing because of mass immunization, because the society's literacy levels are going high. I presume good number of people take this vaccine the moment the child is born, but the vertical transmission is still there. So healthcare personnel as well as society should also be careful about this. Now those unfortunate people who get cirrhosis of liver should get good treatment from gastroenterologist and be careful about the side effects coming out of liver cirrhosis. If somebody is able to keep the liver cirrhosis status into a child A status, then a person can stay healthy, of course with regular medication and medical supervision for a reasonably long duration of time. For these patients, one should be careful about not transmitting the infection to other person, one, and also should be aware when is the right time to get a transplant if things go beyond control. Thank you.